Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back to the Private Practice Survival Guide podcast. In this solo episode, we're talking about some quick tips around creating your practice's compliance calendar. So compliance rarely fails in one dramatic moment. Honestly, it erodes over time, and often we don't see it. It happens through expired licenses, forgotten renewals, overdue trainings, undocumented processes, and ultimately, gross negligence. And so this is about helping you structure and organize different aspects of your private practice that can easily come undone without structure, execution, and accountability. And so a lot of the time, owners fall behind simply because of, honestly, negligence. And it's so interesting because I was working with a private practice in New Jersey, and it was a occupational therapy practice. And one day I came in and the owner was freaking out. It was like, oh my God, Brandon, we're in trouble. And I said, what do you mean? She said, I just found out that one of our OTs let their clinical license lapse. I'm going to say that again. I just found out that one of our occupational therapists let their clinical licensure lapse. And the first question I had was like, hey, what checks and balances did you have? Did you set up the calendar? Did you know it was expiring? And the owner was like, honestly, no, Brandon, like this to me is that clinician's responsibility. I go, I get that, but at the end of the day, our job is to have checks and balances. And I mean no disrespect when I say this, and this may come out disrespectful, and honestly, I think I've said it before in my podcast, but I remember as a child, when I did not take responsibility for certain things, my dad would say, he would have this saying to me, he's like, do you need me to wipe your butt? And I bring this up because the reality is, as a child, it's still it's our obligation to make sure that our children know how to care for themselves, keep themselves clean, do the things that matter. And so to my dad, well, maybe you didn't teach me well enough, or maybe you didn't put in the structure, whatever that is, there's a level of accountability. My point with this clinician was, we need to have a system where 90 days prior to expiration, we need to make sure that the clinician knows their licensure is expiring and all those different things. In this case, the clinician missed out on an entire 12 months of continuing ed. She had a 6-month lapse. I mean, major non-compliance. And so I bring this up because although we could say it's the employee's responsibility and it's part of their employment opportunity, but at the end of the day, it's our job to set them up for success too. And so in our companies, we have these requirements that set up specific reminders, making sure continuing education, licensure, all of that. And obviously, the easiest thing to say is, hey, well, this occupational therapist lapse in licensure allows us to terminate employment with them. But that doesn't solve the bigger problem, which is the caseload. We can't recruit a clinician fast enough. And so this is just one example, and that's what I would call an HR compliance lapse. But there's other things. I mean, we've got, billing, credentialing. I just came across another compliance violation. We took over a new practice that we're doing medical billing for, and they had no clue that they did not have a single clinician credentialed with Blue Cross. They were under contract in network with Blue Cross, but they did not have a single clinician credentialed with Blue Cross, meaning that they couldn't treat the Blue Cross patients even though they were. Again, this is a compliance violation. And when we brought it to them, it was gross negligence. Their statement was, I thought because we were contracted automatically. I'm like, how do you do this? How do you have a practice? And so Part of what we're trying to do is we're trying to put in systems. We're trying to put in accountability. We're trying to put in regulatory notices and different things, because an ounce of prevention is worth a pound of cure. Benjamin Franklin said that. And so in healthcare compliance, that ounce is a well-maintained calendar. How do we structure things? How do we set things up? Even that checklist of calendar, when we bring on a new employee, all the different steps inclusive of credentialing, licensing renewal, TB tests, CPR certification, etc. And so there's a lot of things that are going to be tracked. Every compliance management structure starts with knowing everything that has a deadline. Private practices carry more obligation layers than most owners realize, and this includes clinical, legal, payer, and even human resources domain. So here is just a sampling of some of our compliance categories that we need to have in this compliance calendar. So we need to make sure that we know our clinical licenses. That's every kind of licensure we use, whether you use physicians, physician assistants, nurses, CNAs, OTs, PTs, SLPs, assistants, whatever that may be. We need to include both their state-specific requirements as well as the national requirements and the continuing ed requirements per licensure update. These are things we should be tracking. A lot of the time, some of us track it in HRIS systems. Some of us track it in softwares like Monday.com. There's a lot of different ways to do this, but that's one category, is just your clinical licenses. The next thing I want you to recognize is all of your employment trainings, all of the required trainings. And so that comes down to, HIPAA training, OSHA training, risk assessments, documentation for staff acknowledgments. This continues into all different testing that may be required for your employees. And so some of this is harassment training. Some of this is diversity and inclusion training. Some of this, it can continue. And so anything related to that, that's going to be from our annual training completion, our risk assessments, making sure we have policies and accountability for each employee. So we've got our clinical licenses, we've got our OSHA and HIPAA. The next thing I want you to think about is all of our payer compliance requirements. So one aspect is credentialing, ensuring all those credentialing. And so that's going to be insurance panel enrollments, that's revalidations, that's credentialing updates, etc. Within that, I also want to make sure that we are training on procedural documentation annually. And so with our payer requirements, we want to ensure that our providers understand the different requirements from our payers, whether it's medical necessity definitions, whether it's what procedural codes are appropriate, how we document time in our notes, what modifiers should be utilized in accordance, any changes with NCCI edits. I know you might say well, Brandon, that's more education, but you know what? There's compliance to this, and that requires education in our structure. And so these are things that we should be checking off our team annually to make sure that they are up to date with all calendar year changes and that their payer credentialing as well as the payer policies are up to date. The next thing that we want to look at is our business and HR documents. This is where we look at our business registrations, our professional liability, our workers' comp liability, employee documentation such as I-9s, if we're doing performance reviews, all those different factors so that we have the structure of what is required for our business to operate and function. And so within that, we're also, this could fall under the OSHA and HIPAA side, but safety training, what does safety look like? Patient safety. All of those components are really, really critical. Workers' comp wants to see that you're training your employees on work safety. Drug testing could be part of your compliance and what, depending on the state and requirements. How you operate with background checks, all those different things are part of this that should be tracked. And so strategy number one that I want you to think with, obviously it's pretty simple, but it's it's also complex. I want you to build your master compliance calendar. So a centralized shared compliance calendar is going to eliminate scattered sticky notes and calendar reminders and all of that. And so one of the things that I like to do is I like to have a Google Calendar that is labeled under our organization, our compliance calendar. And then we can share that and have different people that edit it. And again, if you don't do this in Google Calendar, you could do this in Monday.com. You could do this in other areas. Other tools that you may be utilizing for some of the training is like a Trainial, et cetera. And so whether it's a Google Calendar, a project management tool, a dedicated compliance software, this is something that leadership and admin can plan proactively instead of reactively. And what I want is a 6-month alert, a 90-day alert, a 45-day alert, a 30-day alert, and a due date. Ideally, everything is done within 30 days of the due date. What belongs in this compliance calendar is going to be all license expiration dates, all payer credentialing renewal, all continuing ed requirements for the year, annual training due dates for OSHA, HIPAA, safety training, insurance policy renewal dates, open enrollment dates, and when those are due for any benefit enrollments and renewals. Business registration filings, contract review milestones, work comp requirement deadlines, employee annual review dates, and any audits that are required connected to policies and licensure, etc. So we like to do advanced warning. And so again, deadline, at minimum, you need to have a 90-day alert. If you don't have a 90-day alert, you're going to be working behind the times, and especially when continuing ed is due connected. These are all things. So again, 90 days, 60 days, 30 days, 7 days. Early alerts create options, and late alerts create stress. And so sometimes those fines, loss of billing privileges, or regulatory violations can impact your whole business. In this case, not only in the New Jersey example did they go past due, they were treating illegally, and that became a major thing that they had to recorrect and they had to revalidate, etc. I don't think, looking back, I don't think that they saw any treatments under lapse of licensure, but I believe that they had to cancel a lot of visits, and I think they lost around 60 days of patient care as a result. And they didn't have a clinician that could just plug and play. So these are all things. Also recognize that licensure lapse can affect credentialing status. So in this case, it didn't affect the credentialing status, but understanding that is really important. Now, something that I also want to bring to your attention as a strategy is you must have a compliance owner. And so that compliance owner is going to ultimately track deadlines, send reminders, update calendar, escalate issues. A lot of the time, this is where human resources lies. I put this on our HR director. And so sustainability and compliance hinges on distributing the workload. And so designing a trusted staff member, not the practice owner, not the clinical director, but truly a compliance point person, whether that's an HR director, HR generalist, compliance officer, whatever. This is going to offload a critical time-consuming task. And it allows the owners to focus on strategic growth. And sometimes what you're going to do if you're a small practice is you're going to outsource to a compliance organization that will run this for you. In order for you to grow, you must invest in systems, and people manage systems. Who you want to manage that system, that's for you to do. But this idea of I can't afford, honestly, you're never going to grow a business if you just are the master octopus. You have to utilize systems and different people, because in order to grow, you must invest in the growth. And if you're starting a practice thinking that you can just not invest, you're never going to get to that next level of growth. Accountability and growth is huge. I've seen organizations invest, and within 6 months, they've done truly a 300% growth strategy. So plan, strategize, invest, execute, and accountability. That's going to get you to that next gear. So as we look at this, we're going into the next strategy of conducting your quarterly compliance audit. So even though we have annual deadlines, we want to do a quarterly audit. Every quarter, we want to make sure we didn't miss anything. We want to make sure that all of our onboarding of employees have hit our compliance calendar. We want to verify that everyone is active. We want to verify the payer and business insurance changes. If we're going to open enrollment, we want to make sure that we know what that's going to do to our compliance calendar, and if we're changing insurances of any kind. If there is a claim on our work comp or a claim on our liability insurance, we want to make sure we add all of the necessary steps for that to the compliance calendar. We want to make sure we have our training records, our I-9 records, our E-Verify. All of that is all calculated in this compliance audit. We want to make sure each quarter that we document the audit so that we can show what we've done, any policies we've updated, any changes, any findings, have our HIPAA logs, have our security, our IT audits, etc. Because again, part of what we're trying to do is we're trying to show that there's no gross negligence, that there is intention to protect, audit, and stay compliant. And so these are all things that we're working with. And sometimes what I like to do is I like to automate our renewal tracking with digital tools. And so I will build different workflows. For me, I use Monday.com. Other people will use different things. There are compliance management softwares that can do this as well. And it will trigger all your credentialing, training, licenses, everything. It will color code it. It will alert it. It will remove the human memory from the compliance equation entirely. And so automation is going to ensure that no critical deadline is missed due to oversight, provided you set that automation up accurately. One of the areas where I find a lot of people make a mistake is that they set up an automation that's not an ongoing automation. So they complete that cycle and they never renew the next stage of automation. And so it's really important that you're prioritizing that automation capability and component. The next thing I want you to recognize is it's really important for us to have compliance documentation library. This is where we are building our systematic, organized folders. This can be digital, it can be physical. I like digital, where all of our compliance documents live. I have a 400-page HIPAA binder. That is a policy procedure manual. You know, part of this is investing in our library of resources, our assets, how we train. There are different ways that you can invest in different aspects of your practice. MGMA, Medical Group Management Association, has some incredible compliance resources. I also find SHRM, Society of Human Resources Management, has some incredible compliance resources. Building our centralized storage, naming and visioning, putting all the versions of each layer of change, having policies and procedures organized in something like a training, having access and security limited to those that are in part of it, and having an audit-ready proof documentation library of what you've done, how you've done it, where you've stored it, where you've driven it. That is everything. And I just literally met with a practice that went through an audit, and they were so excited because they actually got ranked as the top audit done in the last 3 years by this group. And that's exciting. When you can do that, it's really important. So the reality is compliance is a violation that is happening underneath your nose. And so 83% of HIPAA violations are often by small practices. You know, $10,000 is the starting amount. Is the average OCR fine. And so we're seeing fines sometimes reach $50,000. We've got practices with a dedicated compliance officer are 60% less likely to face scrutiny. 1/3 of private practices experience a lapse in compliance. I mean, that's huge. These figures are underscoring the critical need for robust compliance strategies. And I just bring it to you because I think a lot of the time we're afraid of what we don't know, but knowledge is power. And so compliance is not a destination, it's a discipline. The practice that treat it as a system rather than checklists are the one that will never have to panic. And so for private practice owners, I need you to shift from reactive compliance checks to embedding proactive and daily operations. I want you to have a systematic approach so that you have those safeguards, so that you look at what you're doing, so that you have peace of mind. These are the layers that protect us. And that's why some practices would rather grow fast and fail and learn. I am a slow growth kind of guy. Let's just create our layers of systems. Let's grow slow. Let's grow smart. Let's build some really crucial policies around compliance, and let's have checks and safeguards in place. So the most common compliance mistakes that I'm seeing, private practice owners are often falling into this common pitfall. They're trusting memory over systems. Honestly, we can't remember everything. And so we must have systems. There's a single point of failure. When one individual is exclusively managing compliance, the practice often faces significant risk. We need a team. We need a tribe. We need compliance officer, but compliance counsel. The annual checkbox mentality, a lot of the times we wait for that 1 year and we don't recognize that an annual event does not protect us from regular failure. So we need to have an ongoing process. A lot of the times we see incomplete training records. We're not seeing that you're doing the training. We're not logging that training. Whether you use a mineral or other things, have certificates of completion, showcase that the training has occurred, and then ignoring payer credentialing renewals. I see this all the time. Practices credential once and they think they're good, and they are not renewing credentialing appropriately, and people are getting lapses in credentialing activity as a result. And so whether you're using Google, Asana, Notion, Monday.com, you need to have the right tracking tools. You need to have the right HIPAA compliance platforms. You need to be part of professional associations that are keeping you on target and best in practice, like an MGMA. You need to make sure that you're using the right payer portal, CAQH. And honestly, I'm a big believer in outsourcing credentialing. I think the more that you can outsource creating credentialing as specialty that is getting done regular, it's worth the investment if you find the right company with the right resources. So to implement, I want you to transform your compliance from a burden to consistency. So this week, I want you to pull every license expiration date, enter into one central calendar system. I want you to identify and officially name your compliance point of person as well as counsel. I want you to set reoccurring reminders at least 90 days out in your calendar system. I want you to create the automations in place so that you don't have to manually do everything, and have your implementation checklist ready to go. These are going to help you be prepared so that you're proactive versus reactive. And so as you're creating your practices compliance calendar, you're going to build a master calendar. You're going to assign your compliance officer. You're going to assign your compliance counsel. You're going to conduct quarterly audits. You're going to automate your renewal tracking, and you're going to create a documentation library. And ultimately, you're going to prepare this with structure and checks and balances. Thank you for tuning into this episode of the Private Practice Survival Guide podcast. Don't forget to like us, subscribe, share us with friends, with colleagues, because together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.